So Michaela, we recently had a chance to meet right through some common acquaintances during
Mhm.
our health conferences and all. So, and I was told a little bit about what you're doing, and it sounds very interesting, right? So, can you tell my audience what you are doing, so that my audience and I can learn a little bit more?
Sure. Well, thank you for your interest, actually. So I am a holistic practitioner. So my clients, they get a holistic approach to coaching. And most of my clients are couples that are trying to conceive and they haven't been able to achieve pregnancy for the past more than 6 months, right? So they're considered that they have fertility issues. So it's either I work with just women or just men, or the best is to work as a couple, right?
Mhm.
Because that
Takes two to
way,
make a baby.
exactly. Yeah. Because, but I see a lot of women dealing with that kind of burden, like they're carrying it for the couple. And
Hmm.
yeah, so that's where I come in to alleviate a little bit of that burden and get to the cause of really what's happening. So they can reset their hormones. They can find out what's the core reason of that infertility state that they're in,
Hmm.
and deal with it so they can achieve pregnancy and have a healthy baby naturally without invasive, yeah, procedures. And
Gotcha.
mhm.
Without invasive procedures, right? Because when we talk about invasive procedure, are you referring to IVF, in vitro fertilization?
Yeah, that's one of the procedures. There's also IUI or their
No,
hormone
what does IUI stand for?
intrauterine insemination.
Okay, all right. So in where we're at, we call it artificial inseminations, right? Okay, so we're
Yeah.
talking about the same thing. Okay.
Because it's not, you're not in the state where you're together and you're creating something new, right?
Hmm.
So from two becomes one, and there's a new energy that comes to life. And yeah, so that's why it's important always to look at the man and the woman, even if they say the man sperm level is great, it's good quality, but we never know at time of conception if he's in the same state as they had tested it earlier. So that's why it's always important to work with both men and women. Yeah.
It's interesting that you brought that up. So the question is this: in your experience, how often did you encounter this situation to be with the men not producing sufficient enough sperms?
Oh, it's actually almost 50-50 that
Really?
yeah, it's that usually even if the woman has some physical issues, like they've said, okay, um or she even knows that the menstrual cycle is not regular, so that's a visible symptoms of hormonal imbalance, right?
Hmm.
And they're concentrating on fixing her the period to be at a certain level. But when we also look at the male, and at the same time as the female, right? They live in the same household. They have, there's the energy of how they interact with each other and everything that affects our bodily symptoms, right? When we are
Hmm.
angry or happy, we can even become sick if we are depressed, right? So that's why, okay, don't be depressed. Let's be optimistic. So when they're in it together and encouraging each other, then the male is also has more desire during conception, is more active and produces better quality sperm at that time. And the woman is really being the way we're going. It's that they're not able to, for example, you're not able to see a switch like that, right? Like
Hmm.
we take a pill, for example, and you may see right away the difference. This is so gentle that it becomes so natural that when they're together, they're able to communicate in a certain way that they align to each other. So
Hmm.
I'm working with their energetic energy, really. So
Hmm.
energetic connection. So we want them to be on the same level to be able to connect and create the
So,
baby.
so how long does it take on average for your clients to see results? Now, I'm not just talking about the results of conception, right? I'm talking about the results of experiences, the changes in the body, in the hormones. How long does
Mhm,
it take before they could see
mhm.
the results of their progress, their efforts?
Yeah, so it's because it's a unique process. For everyone is different, and it depends on the person itself. How, for example, how long they've been in that state, how long they've carried that disease. For example, disease meaning not at ease, right? You're in a
Mhm.
disease state. So it could be as early as 30 days, or it could be it could take about 6 months. It really, but you see, in general, you see the first visible changes are within the first 2 months. There will be some shift happening, and you'll notice getting into a better state.
Okay, so when you mentioned better state, what are some of the common experiences your clients report to you after working with you for a month or two?
Mm-hmm. Well, that's again, it's really, there's no common because it's really unique to the person. The only
Gotcha.
common is the physical symptom that you experience. That's the only common. Everything else, it depends how they'll have different reactions when, for example, they're angry, or they have different reactions like they're.
So what are some of the things that you have heard from your past clients during the first month or two that after they started
Yeah.
working with you?
So I'm at ease. I have more energy. Like I'm feeling a shift. I'm feeling something is shifting in the right direction. And but the energy is like number one. I have more optimism, and I see new opportunities coming my way. And as we know, opportunities and optimism is like a number one. It's very important in a patient or in a client, or just so they feel better and they work to their energy up, because we do need energy to move our body, right? If
Mhm.
the energy is low, then you're not able to kind of move forward, because energy moves our body, right?
Mhm. Now, how long have you been doing this?
Well, I've been with that for now over 10 years, because it started really with my son, my firstborn, and
Mhm.
then he had some health issues, so I had to find a way to, constant ear infections, and he was given antibiotics like very often, so his organism started to, not recover. When he would start a cough or something, he would cough for a month. So I tried to find an alternative to what was out there, because nothing was working. I went to a few doctors and tried a lot of cough syrups, but a 2-year-old, you don't want it to keep coughing and not being able to breathe, and not sleep
That's right.
properly, and it's one after another. So yeah, that's how I came into that, and then we started. I
How old
met
is your
with
son now?
somebody. He's 14. Yeah.
He's 14. All right, so you started down this journey with holistic medicine. And of course, when we talk about holistic medicine, what do you mean by that?
Yes. So holistic, we look at the whole um, organism, we call it. So
The whole
it's
individual, right?
individual, yes, because the organism is part of your body, mind, and soul. The soul meaning the energy that's moving that body, right? What's making you get up in the morning, and that's what keeps you going. Once this energy is gone, we are not alive anymore. So that's why it's important to, and that's why I talked earlier a little bit about having good energy, and making sure your energy level is up, because that's
Okay.
what's moving your body.
All right. So you started down this holistic journey, 13, 14 years ago with your own son.
Mhm.
So, all right. So then at which point did you shift over to working with couples who were having difficulty with conceiving?
Well, it started first with me, actually, because of my second child. I had issues conceiving, and I really went into the holistic treatment because of something else. I had severe allergies, pollen allergies. So we were, having couple trouble because of everything, right? You have a small child, you're trying to conceive, nothing is working, you're overworked. And on top of that, I have this severe allergy that I'm not able to breathe. And, when I had.
Did that sound like what your first son was experiencing also?
No, actually, it was different because he had issues with ear infections coming up. So the allergy is a pollen allergy that I experienced. So there's no the treatment was different from the
Gotcha.
two.
Okay.
Yeah.
All right. So you were having all these allergy symptoms, sinusitis, pharyngitis, and things like that. So then, how did that affect your ability to get pregnant the second time?
Well, because you're not able to breathe, really. I'm just fighting for my breath. It was really severe. I felt drugged most of the time, even though I was taking non-drowsy medicine. I didn't really know that affected my pregnancy. It's just the whole situation. There's something that triggered, and we're not able to explain it logically.
So something happened, and you realized that you were having difficulty with conceiving. Is that right?
Yeah. Well, what happened was that I had to miscarry. Like I got pregnant, and then when I went to the doctors, they said there's no heartbeat. So she said you'll miscarry within 2 weeks. A lot of women go through miscarriage. Mhm.
So after that experience, and I'm sure it was a very emotional experience for you. Um, how long how long afterward did you continue to have difficulty with conceiving again?
Well, yeah, I was actually lucky because I consider myself lucky now. Before I was miserable, I was depressed, I was very stressed. But now when I look back, it was like kind of, I see the experience that on a positive side, because I really found out more about what the holistic method could do. And I went actually to get help with my allergies, because I said, listen, if we're going to work, because we were about to break up and, separate the family, and like, okay, we decided, let's work on our relationship and figure things out. So I said, okay, let me go first deal with my allergies so we can concentrate on the others, because I didn't understand what I can do to prevent miscarriage. Like, nobody said, oh, do this or that, so to prevent it. And I don't know why it happened. So we went to see somebody that had helped us with our son, and it actually, within about 30 days of seeing her, I conceived. But I didn't go for that. I went for my allergies. And then my husband also went to see her, actually, but separately, like, because this is individual treatment. And yeah, so it kind of things calmed down in our situation, and we both saw some kind of relief and balance, and it happened really fast.
Wow. So what was the time duration are we talking about here? From your miscarriage, stillbirth, until your conception? What was the time frame?
Yeah, I think it was about 3-4 months.
Gotcha. All right. Okay.
Yeah, because if it was in the summer, the miscarriage, then later on I conceived.
All right. So it sounds like after you started to see the person, the holistic doctor who was helping you with your allergy symptoms, and then you were able to conceive after that. And that was not part of the plan.
No,
right?
no, she didn't even know. She didn't even know I was trying. And
Okay,
it's
what happened
later.
Because what happened after that?
Well,
How
it's
did you make the
later that
connection?
how did she make the connection? It's because me, I made it later. I really made it later, the connection. It's so funny that this when I started thinking about the whole process, because I said, well, this is amazing. I want to learn how I can do that and help other people, because I feel great. I feel amazing. Like, I'm no longer saddened, or I'm not longer dragged down by the whole experience. I don't feel betrayed. I don't feel let down. I moved on, and I kind of, okay, that was a hard experience that I went through, but I grew. So I went into study she was actually, turns out she was a director of the school, of the holistic school. And yeah, so she became my teacher. And once I started studying, I realized what happened, that really when I went for the allergy, I got balanced all over, and my hormones got into place. And of course, like I said, my husband also went to see her. So we both reached to a place of comfort and balance, and we can communicate and talk. And, you don't reject the other, because mentally you don't reject, but your body didn't get the message,
So at this point, were you simply interested in helping others to feel better overall, or were you specifically thinking about how can I use this to help those who couldn't conceive?
I was originally thinking helping others feel better overall, but the theme of people having issues with their period, having pain, and dealing with that, meaning dealing with that with medication, and feeling that that's normal and they should live like that always, and their PMS being, okay, mood changer, right? So when they have their period, their moods change, and their partner is always joking, oh, okay, I know you have your period. It's, why should we live with that? So I started having people coming to me for, okay, let me take care of my hormones, let me take care of my period, and have a better quality of life. So it's just started really one after another, that, okay, by the way, I was having issues conceiving, and I was able to conceive later. So that's how it started. And, it's when and then I remembered what I went through, and I said, okay, so let's just make couple's life easier, because I want to, I don't want, we see it so often that couples get married, they start, arguing. It's like, oh, that's an old couple married, right? It's like, it's normal. Why should it be normal to have miserable life when you're married, or, and have difficulties conceiving and all that? So, yeah, so that's how it started, really, that I said, okay, let's go into helping young couples, or even older couples get the life they dream of,
That's so interesting. So it sounds like you started out with problems involving your upper respiratory symptoms, allergies, and then you felt better overall, which then led you to be able to conceive, even though that wasn't what you were looking for.
Yeah, I didn't
Right.
think that. Because I still didn't make the connection that we need to look at the whole person in order to treat a disease, in a sense. Like I thought,
Mhm.
okay, for my allergies, I'll go look there. For my fertility, I'll go, to my doctor. But like I said, the doctor wasn't giving me anything to make me feel better.
Right.
So
So then you
mhm,
continue with this journey to help others to feel better overall. And during
mhm.
that process, couples coming to you were talking about improvement that were associated with changes in their hormonal cycles.
Yeah,
And
exactly.
then it sounds like people start telling you how they were conceiving when they couldn't earlier.
Yeah, exactly. Because when we go on when we have the follow up sessions, and they're like, okay, well, by the way, I'm pregnant. I'm like, okay, that's great. So,
Yeah.
did you want to get pregnant? And she's like, oh no, we've been trying, but so they usually came with some other problem, and then yeah,
And of course,
so
naturally, as scientists, most likely your initial thought was this was just a coincidence.
yeah, that took me years to figure that out.
So how many years, how long did it take you before you
I
could
realized it.
see the recurring patterns and then you start to have more evidence and then you start to know that, well, this is what's going to happen when we work on these issues.
Yeah, it's probably took me about 6 years to figure this out. But once I wanted to know more and learn about it and see how this really actually moves and affects the bodily symptoms, then then I just concentrated on that and tried to find a system that really is easy to follow,
Okay.
and it helps you go through the process so you can achieve what you desire.
So it
And
sounds like you have specifically worked with uh, women, couples to conceive for almost a decade now. Does that sound right?
no, since then I've started to work on that. It's a little bit less than that. I'm not
Gotcha.
sure. I'm not sure of the exact time, but
Of course.
I because that's what I do the whole like 24/7 and like the whole year. I'm so interested in the movement, the uniqueness of the individual and their stories, that because every person is an individual, right? So what is
Right.
individual means that their experience of life is unique, and that's why it's so important to look at everyone. That's what I mean holistically. I'm looking at you individually as a person, and I want to understand what is unique about you, because knowing
Gotcha.
that and helping you to get to what disturbs you, what disturbs your organism, or what brings you stress, then once you're aware of that, you're able to deal and move past it.
Okay. Well, we had, I'm sure there's a lot more questions that my audiences will want to learn, what will have for you. So with the brief time that we have today, we could just barely scratch the surface. So I'm hoping that in the future, we could get together again and continue this talk so that we can learn a lot more about what you do and the experiences that your clients, the patients have been having. How does that
I'd
sound
love
to
that.
you?
Yeah, I'd
All
love
right.
that. Thank you for your interest. Yeah.
Well, thank you,
Okay.
Ella, for spending this time with us, and we'll see you again next time.
Goodbye.
Bye bye.